Pelvic pain is as unique as you are. Two people with the same sports-related experiences may or may not develop pelvic floor muscle problems, or if they do, they may manifest very differently. Because pelvic pain issues are as unique as the individual, ongoing treatment may look different for different people. Now that you have the tools to treat the problem, decide what you need to continue in order to maintain healthy function and to manage your pelvic, genital, and sexual pain disorder. Here are some suggestions to help you.
Keep up on your pelvic floor muscle strengthening, relaxation exercises. Do 2 to 3 sessions every day. Use the dilator therapy only as needed. After reaching low to no pain with insertion of the largest dilator you need. Use the massage techniques daily with your lotion routine. Make occasional checks through the day for pelvic floor position, clenching, and proper breathing. Continue your hip muscle strength building and stretching weekly.
Many women experience painful sex for such a long period of time. They have no idea where the pain is coming from at first. But as you are able to map out your pain and understand where it is coming from and why, you will begin to notice improvement, and you will begin to be confident that you have control over your pain. Should your pain return, you will begin to know why, and your confidence will build. Your learning curve about your own body will gradually increase, and you will know how you can work to relieve it each time. With the techniques you have learned, you can maintain proper function of the pelvic floor muscles and experience sexual intercourse with much less apprehension and discomfort.
As you sit and digest all the information given to you in this DVD, understand that each person's past experiences, mental, physical, and emotional, are all at work giving you your own unique pain experience. This DVD is meant to create a framework to help you better understand your pain and begin your path to recovery. Knowing that there are indeed anatomic and physiological reasons for your pain is that first step to validating the pain you have been experiencing. The next steps are for you to take. Begin to incorporate some of the strategies you learned: relaxation breathing, checking in with your pelvic floor to allow for relaxation, stretches, all to help minimize your pain. Should you find this DVD to be helpful in your path to recovery, great. If you aren't getting the results that you want, know that the knowledge you have gained from this video is invaluable, and begin seeking further treatment with knowledgeable professionals: doctors, physical therapists, psychologists, sex therapists, and nutritionists. We have provided you with a website to help locate a women's health physical therapist, and they commonly can be a gateway to the other disciplines that you may need. Building your own healthcare team in your own community will allow you to move forward more confidently in your journey towards better pelvic and sexual health. It often takes a multidisciplinary approach to achieve these goals.
As the physician in our group, I would like to encourage you to continue to review the various physical diagnoses that we have talked about and taught you throughout this DVD. It is so important for you to know that these diagnoses are so very common and could be recognized and diagnosed much earlier in young women. Because it will take some time for the healthcare system to teach these conditions of pelvic and sexual pain in the medical schools and residency programs, it is even more important that you become your own advocate to get the support and help you need. Prior to this educational experience, you may not have even heard of such conditions as painful bladder syndrome, interstitial cystitis, generalized vulvodynia, vulvar vestibulodynia, pudendal neuralgia, and pelvic floor dysfunction. These conditions and others just as common, such as endometriosis and irritable bowel syndrome, all can be causes of and triggers for a variety of pelvic and sexual pain disorders. You now may actually know more about some of these conditions than I did for the first 30 years that I practiced OBGYN. The more you know and the more you advocate for yourself and others with these conditions, the sooner the healthcare system will trend towards recognizing how common they are and how important it is to diagnose and treat them as early as possible. The quality of life of so many young women will depend on these issues being included in the routine evaluation of their health care into the future. I was recently interviewed by a young woman named Karen Willis, who, like others suffering from pelvic and sexual pain disorders, is trying to help by establishing support groups and raising awareness on the web. Her interview with me was centered around painful bladder syndrome, but includes questions and answers that I believe could be helpful for all of you to learn more about my own approach as a physician specializing in chronic pelvic and sexual pain. You can find a transcript of this interview and an audio version of it in the bonus features of this DVD.
Using the tools and insights presented in this video, I've been successful at dialing down my own genital and sexual pain. Pain that at one time in my life was seemingly out of my control. I've learned that I'm not alone in this, and though it was hard to come by, I did discover that my pain was real and had real explainable reasons behind it. That alone is a desperately needed affirmation for us. But not only that, we also have the power to affect our pain experience, to disrupt the cycle of persistent pain, and put ourselves on a path to recovery. As we use the solutions we have learned, we find that through restoring function and health, our pain begins to fade. My deepest thanks to our 3 content providers and to you, the viewer, because each of us in our own sphere of influence can be a voice for advocacy, awareness, and change.
As the others have emphasized, this DVD provides information that must be absorbed at your own pace. The more you re-listen, learn, and understand the contents of this DVD, the more the exercises and activities will make sense to you. The multidisciplinary approach of treatment is shown time and time again through clinical research to be the most effective at treating chronic pain disorders. Treating one aspect at a time will not provide the result you seek. Find providers in your community who can offer the medical, musculoskeletal, and neurobiological treatments and support for you as you learn and practice the exercises presented here in this DVD. Thank you for listening, and best wishes on your journey towards healing.
On behalf of Karen, Dr. Eckenberg, Alex, and myself, thank you. We're so glad that you found this resource, and we wish you all the best.